Hello and welcome. You're watching Health and Wellness, Save a Life. I'm Gargi Rawat. As per the WHO census statistics, mortality due to cardiac causes has overtaken mortality caused by all cancers put together. According to the WHO, approximately 4,280 out of every 1 lakh people die every year from sudden cardiac arrest in India alone. Now, the concerning change in recent times is that the onset of heart disease is now seen at a younger age, especially in people who are in their 30s and 40s. The best one can do is to learn beforehand the actions required in case of a cardiac emergency. Life-saving techniques such as CPR can give you power to save a life. It has been proven that bystander CPR improves the rate of survival by almost 50%. It's even more important if you have a loved one who has a history of cardiac disease, as research reports that majority of cardiac arrests take place at home. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. And today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR. We're joined by Dr. Jimmy George, interventional cardiologist, Lizzie Heart Institute, Cochin. Dr. R. Alagesan, consultant cardiologist, retired professor and head of Department of Cardiology, Madras Medical College, and Dr. Sama Akber, director, Oxymed Hospital, Chennai. Thank you so much, doctors, for joining us on the program. Dr. George, first to you, the most common form of heart disease in India is coronary artery disease. Do young people suffer from this heart disease as well, and what is it?
Exactly, Gargi. Coronary artery disease is basically narrowing or obstruction of blood vessels which supply the heart, causing decreased blood flow, leading to chest discomfort and later heart attack. According to the WHO, the incidence of heart attacks in young population is around 1.6 to 2%, whereas in Indian population it is 8 to 10%. That clearly says that we are 4 to 5 times more prone for heart disease compared with the global population. The Indian Heart Association, as well as the recent heart attack registries, have clearly demonstrated that 25% of heart attack occurs below the age of 40 years and 50% of heart attacks below the age of 50 years. The recent death of the singer KK and few of our famous actors in the 40s are example of heart disease at a young age. What exactly causes this heart attack at young age? Is it the change in lifestyle pattern? Exactly. The increased consumption of junk foods, the lack of sleep, the stress, the peer pressure, as well as increased consumption of tobacco and smoking, along with physical inactivity and obesity. Along with that, the early onset of the conventional risk factors like hypertension and diabetes and cholesterol at a younger age makes this younger population more and more vulnerable to heart disease.
All right, Dr. Alagesan, what is peripheral artery disease then? Is it related to a heart attack?
Peripheral artery disease is atherosclerosis of the arteries which supply blood to the legs and arms, more commonly to the legs. The risk factors for developing atherosclerosis of the peripheral artery disease is the same like that of coronary artery disease or cerebrovascular disease. The most important risk factors are smoking and diabetes, apart from high blood pressure, high fat or cholesterol levels, physical inactivity, stress, etc. 1 in 3 patients with coronary artery disease have also peripheral arterial disease. So any patients with these risk factors or any patients with coronary artery disease or cerebrovascular disease should be screened for peripheral arterial disease also. The peripheral arterial disease may be asymptomatic or sometimes it may produce intermittent claudication, that is pain on walking. The pain may be pain over the legs on walking. The pain may be mild, moderate or severe. Sometimes rest pain and night pains can be produced when the disease is severe. Ulcers and gangrene of the legs can happen, leading to death and also amputation of the legs, etc. The disease, peripheral artery disease, can be easily diagnosed by physical examination by palpating the arteries for the pulsation. If there is any doubt, we can perform a vascular ultrasound with Doppler and also arteriogram to visualize the entire vascular tree. The treatment consists of medical treatment of all the risk factors apart from antiplatelets like aspirin, clopidogrel, celestazol, etc. If the pain is not relieved by medication, we can do angioplasty and stenting, and in rare cases, we can do peripheral artery bypass grafting.
All right, Dr. Akber, it's easy to think that all symptoms or signs of heart disease are obvious, but sometimes the first indication of heart disease is a heart attack. So what are some of the heart disease symptoms that people tend to ignore?
Very good afternoon, Gargi. Thank you for the question. At the outset, I'd like to be grateful and humble for being included in such an august gathering with Professor Alagesan and Professor Jimmy George. The heart, as we know it, embryologically, that is from development-wise, in the fetus itself, it shares its nerves right from the lower jaw till your belly button. So the entire course, all the nerves are shared between the heart and these organs. Typically, heart attack is notified by central chest pain, right at the center of your chest, more so towards the left side. It can be indicated by a severe weighted sort of crushing sensation, a weighted chest, and it's a heavy sort of chest. This can cause radiation of pain to the left arm, to the jaw, to the navel, and can also cause associated sweating, dizziness, palpitations, sometimes even a loss of consciousness. Now we should be aware, sometimes just a worsening of your exercise tolerance. If you were able to walk maybe 3 or 4 flights of stairs easily, but you find yourself getting tired even at 2 flights of stairs or even 1 flight of stairs, this can be a harbinger for early heart disease. If you have these sort of symptoms, then you should be aware. Now, if sometimes atypical symptoms, like some people, they have chest pain just after they eat a heavy meal or consume alcohol, this can indicate that there is a heart blockage and they need to get assessed. Many times, early diagnosis and treatment can make all the difference. We should be specially aware, especially because our population has a lot of diabetics. Now, diabetics, they have an altered nervous system. Many times they present with no chest pain at all, just sweating, dizziness, and other symptoms which I mentioned, like an easy fatigability, and they get tired very easily. These sort of symptoms can also indicate that the person is having a silent heart attack, and they also need to get assessed early.
Right. Dr. George, now heart disease can negatively impact people's health well before it's diagnosed. And at what age should then one start getting heart-related screening tests, and which screening tests should be done, given that, we're seeing it in 30-year-olds, 40-year-olds?
Exactly, Gagi. The prevention is always better than cure. So finding out your risk factors as early as possible is always the dictum. If you see the risk factors for an Asian Indian compared with an American, it's almost 3 to 4 times. And that for a Chinese is 6 times, and for a Japanese 20 times of getting a heart disease. So we are very much vulnerable. If you have a strong family history of heart disease, especially a sudden cardiac death, I would say like you need to have an investigation evaluated as early as possible in the 20s itself. Otherwise, if you don't have any risk factors or your family history, it is always ideal to start your evaluation from 35 to 40 years of age. But if you have a diabetic family history, if you are a pre-diabetic, that is something which we miss it up. A pre-diabetic status in young, something between a fasting blood sugar of 110 and 126, or those who are more prone of getting HbA1c higher than 6.5 to 6.8. So all these cases, definitely they need to evaluate with certain investigation at least once a year. That includes a routine electrocardiogram, a stress test in the form of a treadmill or a stress echo, so that you can see your physical activity as well as any changes in the ECG over there. An echo if you're suspicious of any symptoms other than chest pain would also be there, but definitely all these three investigations at least annually after the age of 40 years. And if you come at any of these low risk or intermediate risk with any of these tests, then a calcium scoring or a CT coronary angiogram to see for any cholesterol plaques which causes the obstruction and heart attack also is an important investigation. So to sum up, I would say after 40 years, an annual ECG, treadmill, plus or minus an echo. Then after 30 years, if you are a pre-diabetic, definitely do it up yearly. Otherwise, every 3 to 5 years. And definitely a family history of sudden cardiac death, you should be always prone to do a stress testing and maybe a carotid Doppler to see for any heart attacks or strokes.
Right, Dr. Alagesan, what is the link between smoking and heart disease? All you doctors, tell people to quit smoking first and foremost for the sake of their health. Does smoking then permanently damage your heart?
Yes, tobacco smoking especially is one of the important risk factors for developing atherosclerosis, either of the coronary arteries, cerebrovascular vessels, or the peripheral arterial disease. It also affects the larger arteries like the aorta, producing aneurysms of the aorta. Tobacco smoking causes about 6 million deaths every year, according to the World Health Organization throughout the world. About 10% of the cardiovascular deaths are directly related to tobacco smoking. And apart from active smoking, 10% of this 10% is related to passive smoking or second-hand smoking. There are a number of epidemiological studies which have shown the link between the tobacco smoking and cardiovascular disease and cerebrovascular disease, sudden deaths, etc. But it is not known which chemical of the tobacco smoke produces or increases the risk of atherosclerosis. Whether it is the tar chemicals or nicotine which increases the incidence of atherosclerosis is not known. Even decreasing the level of nicotine in the cigarettes or using e-cigarettes have not reduced the incidence of atherosclerosis of the arteries. There are about 7,000 chemicals. There are about 7,000 chemicals of different nature with more than 72 carcinogenic chemicals which are present in the tobacco smoke. We don't know which of these produces the atherosclerosis. But tobacco smoke definitely damages the innermost layer of the blood vessel called the intima. It produces what is called endothelial dysfunction and inflammation of the inner layer and permits the lipids to pass through and produce plaque formation, which is otherwise called as atherosclerosis. Even smoking 1 or 2 cigarettes or smoking on alternate days or different some days may increase the risk of atherosclerosis. The atherosclerosis risk due to tobacco smoking is higher in younger people. It is higher in women compared to older people and males. Tobacco smoking can produce atherosclerosis, cardiovascular disease, cerebrovascular disease, death, and also aortic aneurysm. And the deleterious effects can be produced by also increasing the heart rate, increasing the blood pressure, and also it increases the LDL levels and decreases the HDL levels. So all these deleterious effects sums up and produces atherosclerosis. Cessation of smoking is one of the most beneficial intervention which can happen. So after 1 year of stopping completely tobacco smoking, the risk of myocardial infarction, stroke, and sudden death decreases remarkably. After 5 years of completely quitting the smoking, the person reaches the risk level of a non-smoker. So quit smoking now.
All right. So that should be a resolution this year to quit smoking completely. Thank you so much. Doctors, will slip into a short break. We have many more questions for you. So do stay on. Everyone stay on. We'll be right back. Welcome back. You're watching Health and Wellness, and we're talking about heart health. Before the break, we were talking about preventive care for heart disease. But let's now talk about treatments. And Dr. Akber, what are the treatment options for coronary artery disease? What combinations of lifestyle, medication, and in-hospital treatments and surgery may be necessary to combat the disease?
Yes, Gargi. With regards to this question, I'd like to divide it into three parts. As you know, India has become the most populous country in the world. We've got 1.4 billion people. We've got a unique proposition where we have three generations with us. The Gen Z, that is school students, students up to college students. To them, I'd like to give an advice that lifestyle changes and physical education should be made mandatory. Lifestyle changes like healthy eating can cause a decrease in blood pressure up to 10 millimeter of mercury systolic. You don't need medications if you start eating eating healthy at a young age in life. Also, if you do regular exercises, this I should try to make compulsory. It would be amazing if we could make it compulsory even in the higher education, in +2 or even in college. If physical education and regular exercise is being made mandatory, it would reduce the risk of developing hypertension even at an early age. Now coming to the millennials, our generation, that is between 20 to 40 years of age. Our generation, we are the predominant workforce. Unfortunately, many of us have already developed some risk factors, as Professor Jimmy and Dr. Alagesan have also mentioned, that we've already started seeding risk factors like hypertension, smoking, diabetes in our systems already. We've had high cholesterol levels, and these sort of risk factors will probably present as chest pain, and when they do, we need to get to a hospital as early as possible. We've discussed how the symptoms would be previously. They need to get an early diagnosis. An angiogram would help them find out if they have blockages in their arteries. If the blockage is more than 70%, it would require them to be cleared. If there are more than one blockages, multiple blockages, and also complex blockages may require them to consult their cardiologist, and maybe they require bypass surgery even. With regards to our parents, the boomer generation, more than 45 years up to 65 and older, these people have already, unfortunately, our elders, many of them have already had heart attacks and heart disease, but this is not the end for them. Even if they have had attacks, they can be on some good medications and regular follow-ups with good cardiologists and general medicine. They can do a lot better. If they have a repeat attack, or suppose they develop chest pain even after bypass surgery, it's not all is lost. They can undergo certain therapies, like we have EECP, enhanced external counterpulsation, which is an FDA approved therapy for people to have better angina tolerance. That is, they have development of collaterals in their already blocked blood system in their heart, and this helps them exercise a little bit more because of the collateral blood circulation. Thank you.
All right, an elaborate answer there in explaining all aspects of it. Dr. George, then, if one has had an angioplasty, so what precautions should patients who've had an angioplasty take?
Yeah, angioplasty or stenting is something which you deploy a stent to remove the blockage in the heart so that the blood flow comes up. It's basically a procedure done through the arm or through the legs, and you need only just a local anesthesia where you can deploy the stent in an emergency situation like a heart attack in few seconds or minutes time. So there's no opening of the chest. The patient can be shifted to the ICU and room in a few hours time, and can be even discharged in 1 to 2 days time. And they can go back to their routine activities and normal work in a week time. That is the most convenient part of it. And even with the newer gadgets available, even when you have blocks in all three vessels, or when you have a completely blocked arteries and all, you can open those vessels by just putting these tubes and putting wires and balloons and stents through that. But what should be a precaution is the continuation of medications, because the treatment is not over. The treatment is just started. They should be on blood thinning agents like aspirin, clopidogrel or ticagrelol or prasugrel like medications, and cholesterol statin medications lifelong, at least for the first 1 year at a higher dose. Then you can just reduce the minimum dose if they maintain their cholesterol levels and decrease their physical activity. stenting and procedures are done so that they can live a normal life. So the normal life should be taken up with physical activities. At the same time, the medication continued to maintain your lipid profile or LDL cholesterol at lowest possible, as well as maintain your weight, as well as if you're a diabetic or a hypertension, control them regularly. And one important thing is if you stop these things, there are high chances in the first 1 year these stents can get attract clots and can blockage happen again and again. So keep your medications, follow up the rules well of physical activity and diet control, and see your doctor regularly.
All right, and finally, Dr. Alagesan, cardiac arrest and heart attack are now commonly seen in young people. Can CPR help to combat such situations? And if you could explain, what is CPR?
Cardiac arrest is a sudden stoppage of circulation of the blood to the various parts of the body. Say this can happen due to two conditions, especially sudden stopping of the heart itself, which is called asystole, or irregular beating of the heart, which is called ventricular tachycardia and ventricular fibrillation. The most common cause of cardiac arrest is coronary artery disease, especially in the adult population. The younger population are also susceptible for cardiac arrest, but the causes vary. In the younger population, it is more often heart muscle disease, otherwise called as cardiomyopathies. There are different types of cardiomyopathies like hypertrophic cardiomyopathy, dilated cardiomyopathy, right ventricular cardiomyopathy. All these conditions can produce cardiac arrest and sudden death. Apart from this, there is a group of conditions called channelopathies, which produces only ECG abnormalities. There are no structural abnormalities of the heart muscle or the valves. So these conditions are called channelopathies, and they go by the name of long QT syndrome, short QT syndrome, WPW syndrome, early repolarization syndrome, Brugada syndrome, etc.
Right.
So these conditions can produce sudden cardiac death and cardiac arrest. And CPR is very useful for reviving the patient.
All right. Well, thank you so much, doctors. I'm completely out of time. Sorry to interrupt you there. We're completely out of time. But thank you so much for joining us and sparing your time and raising awareness about these very, very important issues. Thanks for watching. Goodbye.